Hi, I'm Dr. Feelright, giving you common sense solutions to the problems that we face in our lives. And if you like what you hear, please hit the subscribe button to your right. Today we will examine a malady which is plaguing the world and no solution seems to be at hand. Yet, we've been told that we should be social distancing and wearing masks and sanitizing. But still, this problem remains. It's a worldwide problem, the COVID-19 pandemic. Again, we've been told that social distancing, washing our hands, and wearing masks is a solution. And although we've been doing that, and 70 to 80% of people are wearing masks, the COVID-19 problem is still pervasive throughout the world. In fact, in America now, there are over 3 million cases. So, if social distancing, wearing masks, and washing our hands is the solution, then why do we have this problem? Why is it that we have pockets of COVID-19 which relatively seems like it's an explosion? New York, places like Georgia, places like California, Texas, and other places are seeing the situation get out of hand in some places, and it's almost going exponentially. But still, the recommendation is that we should be wearing masks, and we should be socially distancing, and we should be sanitizing, and all these different things. But still, the problem exists. If that were the answer, we would not be in this dire situation. I have a theory that I have been working on, and I've been using myself as an example, and I've been thinking back to in the past and how I have protected myself from having colds and having the flu. Even before this pandemic hit, I was always cognizant of washing my hands and using hand sanitizer and never touching doors, and consequently, I didn't have colds and I didn't have the flu. But I would notice that people around me would always suffer these maladies, and I didn't think a whole lot about it. I just simply proceeded on in the way that I did. So I started thinking about this, and I examined what we've been told and what people were not doing. And I noticed that there was something special or something significant. And I just observed and I researched, and I came upon the thing that I think may change this, and that's wearing gloves. Nobody is wearing gloves. In fact, if you look around, do yourself as a reference point. Just go around and see the people that are wearing gloves in grocery stores or in these big events where people are protesting or where there are parties or barbecues. Nobody's wearing gloves. That may be the common denominator, and that could be the thing that stops all of this, because we're told to wear masks, but the N95 mask is the only mask that filters 95% of particles, but that's not 100%, which means that even if you wore an N95 mask, you still can be susceptible to the particles. The mask that most people wear, the cloth mask or the paper mask, those are just minor deterrents to the coronavirus. And we've already been told this, that they do not provide protection to the level of the N95 mask. That's the mask that you see the healthcare workers and the doctors wearing in hospitals. The common person does not have an N95 mask. The cloth mask, the paper mask, is just simply a minor deterrent. It's better than nothing, but it's a minor deterrent. Here's the thing about that. When they talk about the mask as a deterrent, it's basically to keep the coronavirus, if you have it, away from other people. In other words, it's a deterrent from you spreading the virus. But they've already proven that it's less of a deterrent to you catching the virus. And as we all know, it only takes one particle of the virus to infect you. So I think that the mask gives people a false sense of security. They think that, well, if I have on a mask, I'm protecting myself. And as you see, like I said, do it for yourself. Look around and see the number of people that are actually wearing gloves. And I would venture to say that in a crowd of 100 people, you may have possibly 1 or 2, and it would probably lean more towards 0, because most people do not think about the glove as protection. Let me give some examples of how the glove could be the thing that changes the game in the coronavirus fight. Okay, say for example you went to a grocery store. I'll use myself for an example. This is what I do. Before I go into the grocery store, I make sure that my gloves are on. And whether I touch a cart or something that one of the workers may have touched when they're stacking the groceries up, or touching the machine when I'm checking out, it doesn't matter what I might have contacted within that store, because when I get to my car, I use hand sanitizer to sanitize the gloves. So what I have effectively done is I've given myself 2 levels of protection: the glove and the sanitizer. Then, after I take the gloves off, I sanitize my hands. That's 3 levels of protection. When I get home with my groceries, depending on how wary I was about going there, I would sanitize the groceries or the cans or whatever with some spray, Lysol, or whatever you might use, and then I would put them all away. But see, here's the thing about the glove, is that it provides a layer of protection from infection that even the best mask cannot provide. You have the outer layer of the glove that's touching everything that could potentially be infected with the COVID-19 virus, and then after you take the gloves off, you have your hands, which you've sanitized, and then you go home. Presumably you would wash your hands. We would think that would be something that would be automatic, but here's the thing about wearing a glove: that is something that would remind you to wash your hands. Okay, let's say for example you didn't do that, which is what most people don't do. They don't wear the glove. They have the mask. So they go into the grocery store and they're thinking they're safe because they have a mask on. And so they go and touch the same thing. They touch the can or the item that the person who had stocked the grocery store touched. And just so happens that there was some coronavirus on some of that. So this person goes home and takes the groceries with them. They bring it into their house. They don't think to sanitize anything because it's just so part of the routine I have a mask on and I'm safe. So they put the groceries away. They may forget to wash their hands or sanitize their hands, and then they touch something, some food item, and then they touch their eye or their mouth or whatever, and then bingo, you are infected with the coronavirus. And that's not so far-fetched to think that it happens that way, because if you think about it, there are hundreds of times that you are touching different things throughout the day, and depending on what kind of job you have, you might be touching something 200 or 300 times in a day. So if you're not the kind of person that was used to washing your hands or sanitizing your hands before the COVID-19 pandemic hit in the early year, then it's kind of hard for you to readjust your mindset to all of a sudden be the kind of person that's always washing their hands and sanitizing everything. So it's easy for something like that to slip through the cracks, and you touch something when you're out and about, and then you touch your house or something in your house, your doorknob, or you touch a plate, or you touch your child or whatever, and then you have the coronavirus in your house. So the glove is something that not only does it make you think about what you're doing, it provides a protection that a mask does not. I sincerely believe that this is how this is happening. I sincerely believe that people are so confident in wearing their facial protection that they're not thinking about the fact that they're touching things and bringing things into their homes. So it's so easy for you to touch something and forget. It's so easy, in fact, that your children are touching things, and you're touching your door, you're touching your car keys, and you're touching plates, and you're touching light fixtures. Any infinite number of things you could be touching, and you have transmitted something from the outside into your house just because of the fact that you didn't have that first barrier, which was the glove, and that protected you from bringing that particulate matter into your house. So I want you to think about that. Give that some serious consideration, because if you think about this one thing, this will kind of bring it home. No doctor performs a surgery or a dentist performs any kind of oral surgery or procedure on your mouth without rubber gloves, because they understand that it's easily transmitted. Like say if you got some disease or some sort of particle or whatever on your hand, is easily transmitted from patient to doctor or back and forth. So they always make sure that they scrub their hands before they put on the gloves, and then they put on the gloves and they scrub afterwards, because they know that the hands are easily a medium to transmit infection. So that's why you always see nurses and doctors, they're wearing gloves. So if it's important for a doctor or a dentist or a nurse to have gloves on when they're in hospitals, that should tell you something right there, that the glove is something that could curtail this, because it's blocking a transmission through a point. Now, if we were to shift our focus away from always talking about masks and include masks and gloves, I'm sure that we will see a precipitous drop in the number of coronavirus cases around the world. The problem is when a normal layperson says something like that, people have a tendency not to listen. If Dr. Fauci said this, or if someone on CNBC said this, or one of the doctors on one of those daytime shows were to say that, then the world would pay attention. But someone like myself, who is not a national figure saying this, you might have a tendency to say, well, he's not an expert saying this. But what I would say to you is to use your common sense when you're thinking about this, and you think about the way that the virus is possibly transmitted. You don't see people walking around hacking and coughing and sneezing, because if they were to be doing that, they would be persona non grata. You would say that people would be moving away from that person like they were the plague, pardon the pun, but that would be what would be happening. People would be moving away and distancing from the person. So that is the least of the methods of transmission in my mind that is moving the coronavirus around this world in such a rapid pace. I think that it's because people are touching things, and they're touching things in their homes, and they're transmitting it to people from doorknobs and different things like that. And that's why this is spreading. So I believe we can save the world. If we pass this information along and we start thinking about the glove as a weapon against the coronavirus, we could save the world. So I would ask you to consider wearing a glove, a pair of gloves. The gloves would be another method of protection against the coronavirus. And if you didn't think anything else about it, you have to admit the fact that that is true, that the gloves provide another level of protection against the coronavirus. So I am asking you to join me in this fight to spread this information around the world so we can stop this menace. You and I together can do this. If we can get this information out to everyone, we can stop this menace. But we have to work together, and you have to make a concerted effort yourself to wear gloves along with your mask, hand sanitizing, and social distancing. I'm Dr. Fielwright. Thank you for listening.